If you are somebody who takes medications, particularly prescribed medications, on a regular basis, or just vitamins and minerals, if you're going to the doctor, you really should have a list of them to give to the provider because we need to put that in your medical chart so we know what you're taking. A lot of people tell me that they take a blood pressure med or a diabetes med, and that not the most helpful because there's lots of different ones of those. So let me tell you what information should be on your list when you're making a medication list. First things first, you can absolutely handwrite this or type this out. It does not matter. Just make sure it's legible. It makes my life easier. I'm going to use my prescription Entresto. So first and foremost, obviously, you need the name of the drug. So for this one, it would be Entresto. Most medications will have a brand name and a generic name. This is the brand name for a combination med. Whichever name is on the bottle that you get is fine. If both names are there, just pick whichever one is easier to write down and or type out. Unless it's very specific, like you have to have the generic or you have to have the name brand due to whatever the additives are. Next, I need the strength of it. So that's typically the milligrams or the micrograms, whatever it is. Now, since my Entresto is 2 medications in one, that's why it has 2 numbers there. Most medications will only have 1 number there, but that is really important. I need to know how much of the medication you're taking. What is the dosage strength? A lot of medications will come in different strengths, so we need to know which one. Next, how do you take it? So that would be the by mouth. If these are pills and you're taking pills, it's by mouth. But there are medications that are lotions or eye drops or other assorted things. Make sure I know how you take it. And if you put something like 1 pill a day, I can figure that you're just swallowing it. And lastly, how many times a day and when you're taking it. So this one is twice a day. You can see on there, it says morning and evening. This is what I particularly ask about when it comes to something like a cholesterol med, like the statins, should be taken at bedtime. So making sure you know when you take it. And that's really all I need. I don't need you to have listed what it's for. If that helps you, that's great. So just to recap, we need the name of the medication, the dosage, that's the milligrams mg or micrograms mcg. We need how you're taking it, normally by mouth, and when you're taking it. Or is it more than once a day and you take it at different times? If you have all this info on a list, you can just hand it over to the MA, the nurse, the provider, whoever, and we can very quickly update your chart and make sure we're taking care of you correctly.